Hello everyone, welcome to the Corpus. So our today's topic of discussion is about measles virus. So let's start. Measles. In measles, what measles causes? Measles causes skin infection, skin rashes. So the skin rashes, which is caused by measles, was first reported back in by an Arabian physician, which named as Abu, and he called them as Hasba. Hasba. He called them as Hasba. So, what is measles? Measles is a acute, highly contagious disease which generally affects the children's. There is fever and there are also respiratory symptoms which is associated with measles. There are maculopapular rashes, and measles is caused by measles virus, which is a type of a RNA virus. Is a type of a RNA virus. And the closest relative of measles virus, measles is a human virus. It affects human. The closest relative of measles is rinderpest virus, which is not a human virus. It is an animal virus. It generally affects the animal population, not the human population, and is the closest relative of the measles. Now we are going to talk about the pathogenesis of measles. In the pathogenesis of the measles, the droplet inhalation and small particle aerosol. The measles is transmitted through them. The small particle aerosol have the tendency to suspended in air for a longer duration of time, so they'll affect children at multiple places like school, library, parks, etc. And the viruses then goes to the respiratory tract where it multiplies locally, and then goes to the regional lymph node and then the blood stream. And the blood stream, the virus will go through the reticuloendothelial system, RAS, in which it will multiply further and again comes into a bloodstream and cause secondary viremia, and then it disseminate to various sites such as skin, respiratory tract and conjunctiva. Now we are going to talk about the clinical manifestation of the measles. In the clinical manifestation of the measles, the incubation period for measles is 10 days. And there is and the measles and the clinical manifestations characterized by having 3 stages: the prodromal stage, the eruptive stage and the post-measles stage. 10th day. Now we are going to talk about the prodromal stage first. So the prodromal stage, after the 10-day period of incubation, the prodromal stage starts, that lasts for 4 days, and from the 10th day to the 14th day. The 10th day there is an onset of fever. There is an onset of fever on the 10th day, and on the 12th day there is Koplik spots. What are Koplik spots? Koplik spots are the white spots which is surrounded by the, as you can see, which is surrounded by the erythematous border. They are white in nature, white in color, and they will fade with the onset of rash that will appear in the second stage, which is eruptive stage. Eruptive stage is marked by having maculopapular dusky red rashes. It happens on the 14th day, and the rashes will start behind the ears and then goes to face, arm, trunk, legs, and they will fade after 4 days. Now the post-measles stage happens when the measles virus get eliminated from the body. It is characterized by having weight loss. The patient will have weight loss, and it is generally due to the failure of recovery. The patient is not able to recover completely. Then that's why he goes to post-measles stage, and it's rare. Now we are going to talk about the complications of measles. In the complication of measles, the age group which is affected in measles is less than 5 years and more than 20 years. The complication includes secondary bacterial infection, which is generally due to post-measles immunosuppression, and it will cause otitis media and bronchopulmonary pneumonia, otitis media and bronchopneumonia, secondary bacterial infection. Now we are going to talk about the complications of measles itself. These are not any secondary bacterial infection. These are the complications of measles virus itself: giant cell pneumonitis, acute laryngotracheobronchitis, diarrhea. CNS complication. The CNS complication includes subacute sclerosing panencephalitis (SSPE), post-measles encephalomyelitis. Now we are going to talk about the laboratory diagnosis of the measles. In the laboratory diagnosis, the specimen we take is a naropharyngeal swab, conjunctival swab, and respiratory secretions. Antigen detection is done by direct immunofluorescence test by using anti-nucleoprotein antibodies. Now the third one is viral isolation. Viral isolation is done in monkey. The viral grows in monkey and human kidney cell lines, and the cytopathic effects of the virus will be noted, and that will help us to differentiate between other types of virus, such as herpes virus or other type of virus. In herpes virus, there is a round and ballooning of cells, as you know. The cytopathic effect of the measles virus is multinucleated giant cell, which are also known as Warthin-Finkeldy cells, which have intracytoplasmic and intranuclear inclusions. Now the fourth one is antibody detection. In the antibody detection, we detect measles specific IgM antibodies. And in case of SSPE, what is SSPE? Subacute sclerosing panencephalitis. We take CSF. And we detect anti-measles antibodies in the CSF by using ELISA, enzyme-linked immunosorbent assay. Now we are going to talk about the fifth method of laboratory diagnosis of measles, which is reverse transcriptase PCR, in which we amplify the gene. We amplify the gene by using PCR. We amplify measles specific RNA, in which there is N gene, nucleoprotein, and the RNA will be detected 14-day post rashes, which rashes appear on what day? On the 14th day, and the RNA we are able to detect RNA 14-day post rashes, which means we can able to detect RNA up to 28th day of infection. The treatment, now we are going to talk about the treatment of the measles. The treatment of the measles is, there is no specific treatment for measles. There is only symptomatic treatment which is given in measles. So this was all about the measles virus. I hope you will understand. If you have any queries, just leave a comment down. Thank you.